In Washington, the House's two top Democrats are pushed apart as they clash on what it will take to get the health care reform bill to pass. Meanwhile, here at home, South Dakotans today trying to understand the complicated proposal at the first town hall meeting in Rapid City. This story is first on Fox. Good evening and thanks for watching tonight. I'm Lindsay Kruger. Town hall meetings to discuss Obama's health care plan have been taking place all over the country. Today was Rapid City's turn, where residents discussed the pros and cons of the president's proposal. Black Hills Fox reporter Al Van Zee has the story.
You can sign one of these cards and send it to your representative or your...
Today's town hall meeting in Rapid City actually took place at a city park along Rapid Creek. The town hall meeting format was intended to provide feedback to lawmakers. But absent from today's meeting were the state's elected members of Congress, all of whom had been invited. Instead, congressional staffers answered the questions from those who support public health care and from those who oppose it. Most of the questions and comments were from those opposed.
Ones that don't have insurance are usually going to be your illegals because they go to the emergency room more often because they don't have insurance.
If they get control of our health care, it's going to be like some of the foreign countries where you can't get in. The doctors don't want to work because their wages are set by the government. It's just a bad situation all the way around.
But there were also those who favor a national health care system. Those who favor a new system say the present system is far too expensive, the most expensive in the world. If left alone, they say, it will bankrupt the government and the economy as it grows more and more expensive.
Currently, the private insurance industry tells doctors what care is authorized or not authorized based on profit. They deny care to people so that they can increase their profits. When we rely on emergency rooms for care, we end up paying for that. It's not free. The people who go to an emergency room without insurance and can't pay, that causes the hospital to increase their charges to the rest of us who can pay.
The absence of the state's congressional delegation caused speculation in the crowd as to why they were absent. Thune, Johnson, and Herseth Sandlin all had reasonable-sounding rationales for not being able to attend, but some in the crowd speculated that the delegation simply didn't want to face up to the questions being asked. Others said it was the raucous and disruptive crowds and sometimes guns seen at rallies like these in other parts of the country that convinced the delegation to simply stay away. But today's crowd in Rapid City was well behaved, and the question and answer sessions were carried out in good order. There were arguments and sometimes heated discussions. There was the noise of democracy, as James Buchanan called it. But there were no punches thrown, and there were no guns visible. Al Van Zee, Black Hills Fox News.
Those belligerent crowds in some other parts of the country illustrate the increasingly militant tone of the debate over health care. But South Dakota Senator Tim Johnson said Friday in Rapid City that he has faith South Dakotans are good people who will not resort to rude or violent behavior as they discuss vital issues.
The vast majority of people are good Americans and have no time for this distortion and fabrication of illness. But there are a few who make trouble and are irresponsible doing it.
Johnson says the country can't afford not to do health insurance reform. He says, quote, the cost increases are killing us. Senator Johnson says he intends to take part in a modified statewide town hall discussion on South Dakota Public Television next week, where he'll take questions on the health care issue.